Hello, wonderful women. It's Claudia here from Nourished by Claudia, founder of the Period Comeback Protocol and the Recover from HA support group on Facebook. And I'm very excited to be here today because I would like to address HRT as a topic. There has been so many questions on the Facebook group lately, and I keep receiving DMs where people, and specifically women, they ask me, is HRT gonna kickstart my period? Is it gonna be a helpful treatment for me so I can get out of amenorrhea? So in today's conversation, I'm gonna address a few pointers. First of all, what is HRT? The difference between HRT and bioidentical hormones. And then finally, I'm gonna talk about the side effects of being on HRT for a long period of time and if it does kickstart a period. So without further ado, let's get started, okay? So first of all, what is HRT? HRT stands for hormone replacement therapy, which is a medical treatment that involves the use of hormones to supplement or replace the hormones that the body may not be producing in sufficient quantities. And that's something that you may be very familiar with, especially if you have been suffering from hypothalamic amenorrhea for a very long period of time. Normally, the hormones that are used in HRT are estrogen and progesterone, and they're used to manage symptoms of hormonal imbalances. So HRT is used for different purposes. So the first one is to manage symptoms of menopause. What are those symptoms? Normally are hot flashes, vaginal dryness, mood swings, and insomnia, sleep disturbances. And those symptoms are also very common in women with hypothalamic amenorrhea because normally they're caused by a lack of estrogen. The second reason why HRT is normally considered is to prevent osteoporosis. As you may know by now, estrogen plays a very fundamental role in maintaining bone density. And specifically postmenopausal women, they do receive HRT to reduce the risk of osteoporosis and to reduce the risk of fractures. Another ways on how HRT are used is for gender transition, other medical conditions. So, for example, they can be prescribed after cancer, for endometriosis or other reproductive disorders, and obviously also to treat hormonal imbalances, such as hypothalamic amenorrhea, a POI, which stands for primary ovarian insufficiencies, and sometimes even for PCOS. So there is such a big talk about bioidentical hormones, and I really would like to address the four main differences between HRT and bioidentical hormones so you can actually make an informed decisions of which one you want to try if you decide to go ahead and go down the route of hormone replacement therapy. So the first thing that we need to address is the composition, okay? So synthetic hormones are not structurally identical to the hormones that are produced by our body. The bioidentical hormones instead are compounds that have the same chemical structures as the hormones that are normally produced within our body. So the hormones that are included in the bioidentical therapy are estradiol, which is a form of estrogen that is naturally produced by our body. The second thing is regulation. So synthetic hormones, so HRT therapies are regulated and approved by government agencies like the FDA, which is the US Food and Drug Administration. Bioidentical hormones are typically compounded or customized by pharmacies based on individual needs. So it allows a more personalized treatment, but they are obviously less regulated. Okay, so the regulation of bioidentical hormones is not present at the moment, and they are considered compounded medications, which means that they are normally mixed or prepared by compounding pharmacists. Okay, according to what the medical providers think that it's a decent amount. HRT normally comes with the same dose. So synthetic hormones therapies typically come in one standardized, such a big word for me, dosages of formulations. And the healthcare provider is going to decide which one is the good one for you, but normally they normally stick to the guidelines. that's very different when it comes to bioidentical hormones, because the dosages are tailored to the specific need of a woman. And last but not least, the potential side effect, which we're gonna cover later on in this video. But some synthetic hormones used in HRT have a different chemical structures than the natural hormones, and they do lead to potential side effects and some health risk. And that normally is not seen as much when taking the bioidentical hormones. It's also important to note that the use of bioidentical hormones is a topic of controversy and debate in the medical community. And some healthcare providers are happy to allow their patients to take bioidentical hormones, and some medical providers are completely against it. And that's something that I really would like to underline. So why are women with hypothalamic amenorrhea prescribed HRT? So the reality is that HRT can be beneficial for some individual with amenorrhea under certain circumstances. So that's how HRT can help. The first thing is hormone restoration, right? So if you don't have enough estrogen, you don't have enough progesterone, and you're experiencing a lot of symptoms, then HRT can definitely help, because it can allow you to have those necessary hormones and to trigger and regulate a menstrual cycle. And we're going to discuss this a little bit more later on down the track. The second one is bone health. So prolonged amenorrhea can lead to decreased bone density, as I mentioned before, due to the loss of estrogen. And HRT, they do help to maintain bone density. They don't allow the body to create more osteoblasts and osteoclasts, but they basically stop the the words are failing me today, but they're basically maintaining your current level of bone density. Something else that they can be really helpful for is the relief from symptoms. So women with amenorrhea, they tend to experience also vaginal dryness and lots of mood swings, very similarly to perimenopause, and HRT can sometimes alleviate those symptoms, depending on the woman, because sometimes they do not work. Fertility is another way to use HRT, because they may restore the menstrual cycle, and if you do restore the menstrual cycle, you have better chances of getting pregnant. Having said that, sometimes HRT, they can suppress ovulation completely. And another way in which they are used is just to enhance the quality of life, because HRT can improve the overall quality of life for individuals that are experiencing severe symptoms related to amenorrhea, such as insomnia, vaginal discomfort, dyspareunia, which is pain during sex, and, as I mentioned before, anxiety and depression. It's very important to note that HRT is not suitable for everyone, and there are potential risks and side effects that are associated with the hormone therapy. HRT should not be considered a long-term solution, especially for women that are in the fertile window. And when I say fertile window, it's somewhere between the age of 18 to the age of 45, 48. During that time frame, it's highly recommended to regain their period in the natural way. So the goal is often to use HRT to address the immediate issues related to amenorrhea, and then transition to other therapies or lifestyle modifications that can really restore that hormonal balance. Okay. Now let's talk about the side effects of HRT. The first one that it's commonly experienced is breast tenderness. One of the most common side effects of estrogen-based HRT is breast tenderness and also enlargement. Another one is irregular bleeding. So bleeding that can happen at any time during the period. And this is more common with combined estrogen and progestin therapy. And I say progestin and not progesterone, because progestin acts very differently within the body. Another one is mood changes. So sometimes HRT alleviates anxiety and depression, sometimes it can worsen it. So it really depends on the individual. Another one is headaches, nausea. Those are listed as some possible side effects, but once again, they don't happen that frequently, and they don't happen in every single situation. A big one is fluid retention. Some women may notice this mild fluid retention, and that leads to get weight or bloating. Blood clot risk, it's a big one, and that's one of those side effects that I really would like women to be aware of, and that's even more pronounced when HRT contains estrogen, which is associated with a slightly increased risk of blood clots, especially in an individual that has a past history of blood clotting or problem with their blood anyway. Another one is cardiovascular health, breast cancer. The use of estrogen progestin combination HRT has been associated with a slightly increased risk of breast cancer. So normally your healthcare provider is going to ask you for your past history and also your family history in terms of cancer. Bone health. So HRT can have positive effects on bone density by preventing osteoporosis in the short term. Long-term use of HRT should be carefully considered, as it may have the potential risks for bone health in the future. And that's something that is normally not discussed. And last but not least, digestive symptoms. And some women may experience lots of reflux, bloating, fluid retention, and problem with their digestion in general when taking HRT. There is also something else that I would like to mention, which is coming off HRT. So let's say that you've been on HRT for an extended period of time, and if you stop taking it, you may feel lots of side effects in a very short amount of time. For example, weight loss, hair loss, changing moods, pronounced anxiety, sleep disturbances, and also problem with your cycle. So these are all things that need to be considered even before starting HRT. I also normally advise the women that work with me to start taking HRT only when they have an exit plan, meaning that it's really important to have a conversation with the medical health provider and ask them, for how long do I need to take them, and what do I need to do while I'm taking it, and when am I gonna stop taking this medication? Because once again, it's a medication that back in the days was originally created for women in perimenopause. So if you're not in perimenopause, if you're not suffering from POI, if you didn't suffer from a cancer that really stopped your menstruation, then I would really encourage you to get your period back naturally. Alrighty. Very important questions that I keep on receiving. Can HRT kickstart a period? So what HRT is going to do is going to encourage, so it's going to mimic the natural cycle, especially when progestin is part of the therapy, and it's going to encourage the growing and the shedding of uterine lining, which is the endometrium, which is then cause a withdrawal bleed or a period. In this way, it can initiate menstruation in women that do suffer from hypothalamic amenorrhea, but they're not really kickstart the natural period. After the withdrawal bleeding, some individuals may experience a return to the regular menstrual cycle if the underlying hormonal imbalance has been corrected. So I'm going to repeat this because it's very important. After the withdrawal bleeding caused on HRT, and I would like also to say that lots of women that take HRT, they don't see a bleed. But if they do, some individuals, some of these women may experience a return to the regular menstrual cycles, especially if the underlying hormonal imbalance has been corrected. So what does this mean? That it's really important for you to work on recovering your menstrual cycle. Doesn't matter if you are on HRT, if you are considering HRT or bioidentical hormones, or if you have decided to stop taking them. Always remember, I really would like you to take two things out of this video. The first one, if you decide to take HRT, make sure that you have done your due diligence and that you have spoken with your healthcare provider about your family history and your current health history. Make sure that you know the ins and outs of your treatment protocol. Make sure that you know exactly when you're going to stop them, especially if you are within the fertile window between the age of 18 and 45, when you're still on time to regain your menstrual cycle, unless you have different circumstances going on. And last but not least, and very important, make sure that you work on restoring your natural period by really doing all the things that have been causing you to miss the period in the first place. If you would like to learn more about this, if you need to learn strategies in terms of how to get your period back naturally, and if you would like to have a conversation with someone that really know how the reproductive cycle works, please don't be afraid, just send me a DM. And if you feel called to join the Period Comeback Protocol and the beautiful HA community that is thriving with women that really wants to get their period back, let go of the symptoms and boosting their fertility, make sure that you join us today by clicking on the link below or by simply sending me a message. I see you on the next video, and thank you so much for being here. Bye for now.